You guys ready?
Yeah.
All right, and action. All right, guys, Mr. Merlin here, Mr. Am, and today we're going to be doing sacrum and coccyx. And we're going to be doing the AP axial sacrum, we'll be doing the AP axial coccyx, and then we're going to go ahead and merge the sacrum and the coccyx lateral together. Normally the book has them separately, but we're going to just do them together, okay? So we already have the patient on the table. They're in a supine position here right now. What we're going to do is we're going to put a little sponge underneath his legs. We're just going to flex it a little bit. All right, you can bring your legs down. There you go, just like that. So just slightly flexed. We're going to go ahead and start with a 40-inch SID. And for the sacrum, it's going to be 15 degrees cephalic. And I remember just bugging my wife. I'd be walking around the house saying sacrum cephalic coccyx caudal. And I would say that repeatedly over and over and over again. And she would say, would you stop it? And I'd be right in her face. Sacrum cephalic, right? Coccyx caudal. So I would just say that repeatedly because, again, the sacrum is going to be 15 degrees cephalic and the coccyx is 10 degrees caudal. They use the same central ray location, so it's going to be really easy. So we'll go to 40 inches. And I know I'm going to go to 15, so I'll just go to 37. All right, so we're going to go to 15 degrees here. There we go, 37. And we're going to center between the ASIS and the greater trochanter right here because that would be the symphysis pubis. So his ASIS is right here. His symphysis pubis is going to be aligned with his greater trochanter right here. So the distance between the ASIS and the symphysis pubis is 4 inches. So if you go 2 inches from the ASIS or you go 2 inches above the symphysis pubis, it's going to be the same. It's going to be midway between those 2 points. So this is where we're going to center going across. Now, I have to make sure he's centered, so the mid-sagittal plane has to be down the middle. So, all right, that looks pretty good actually. We're going to go ahead and collimate to 10 by 12 on this young man. All right, so we got 10 by 12. All right, so this is your AP axial sacrum. I just have to make sure my receptors lined up. I'm going to use my right marker. So the sacrum is going to come down. It's going to look like a shovel. So I put it up here towards the upper portion of the square here, just like this. Half of the half, slightly towards the lateral border. I close this up. Technical factors are going to be about 40 mass at about 84 kV for the sacrum. You can always go more or less depending upon the body habitus of the patient. But I think for this young man, I'm going to go to about 50 mass at about 84 kV. All right, so what I like to do is this. I like to pinch the gown, just kind of pinch the gown right here. Don't pinch the patient, but pinch the gown because I'm going to use the same location for the coccyx. I'm just going to change the direction of the angle. So I'm going to go ahead and have him breathe in, breathe out, x-ray clear, beep, we're all done. Now we're going to go ahead and have you breathe, relax. We're going to do the coccyx now. So now I'm going to go to 38 inches. And guess what we're going to do? We're going to angle at 10 degrees caudal now. So let's see here. There we go. I got a little OCD when it comes to the SIDs. All right, so now remember that pinched area of the gown? We're just going to bring it back here because it's the same location, but now because we're changing the direction of the angle, we're going to come down here, just like this. I'm going to bring this marker down just a little bit because I'm going to go ahead and just make the field of view just a little bit smaller, about 1 inch. So I'm about 8 by 10 now for the coccyx. I like to make it smaller. The textbook says, 8 by 10, but I like to make it a little bit smaller, just like this. You don't need a big, large field. But then again, look, the central ray location is the same. So this is why I like to pinch the gown, right? Sometimes some techs will have the patient put their finger on that area. Sometimes the patients are not coherent or they're not cooperative. And sometimes I just don't want them to be that involved when it comes to, marking their own central ray. But that's okay. But this is going to be your coccyx. So again, 10 degrees for the coccyx. So sacrum cephalic, coccyx caudal. So the other thing that I remember is 15 degrees and 10 degrees. The sacrum is higher in position. The coccyx is lower. So that means they're going to have a higher number of degree of angulation for the sacrum at 15 degrees and then 10 for the coccyx. All right, technique stays about the same. So we're going to go ahead and keep it about 40 mass, 50 mass for this young man, 84 kV. Go ahead and breathe in, let it out, x-ray clear, beep, okay. So now we're going to transition to our lateral. So what we're going to do is I'm going to take this away. We're going to go ahead and bring this back to perpendicular. But before we have them turn over, I'm going to put it to where I think it's going to be centered already. I'm going to put it to the region I just had it centered. Now I'm going to have you turn on your left side facing that wall right there. You're going to put your hands, your knees together. You're going to bend them. Right now he's kind of at an angle, so I need to straighten him out. I'm going to bend my knees. I'm just going to give him a little push right here. All right, they're very easy to move around. All right. So now I'm at the level that I want to be close to. This is about 3.5 inches behind the ASIS. His ASIS is here, his crest is here. ASIS is here, so we're about 3.5 inches back right now, all right, where I want to be centered. And then, because we're doing the sacrum and coccyx together, I'm going to come down 2 inches. I'm going to open up the size of the field to 10 by 12 here, and there we have it. So again, right there we go. So I need to be 3.5 inches back from his ASIS. His ASIS is right here. So 3.5 inches back, right there, and then 2 inches down from his ASIS. So we're doing the sacrum and coccyx together. So textbook-wise, if you just do the sacrum only, you just go back 3.5 inches back. If you're doing the coccyx, you go 3.5 inches back and then 2 inches down. But what I like to use is the iliac crest, and here is his greater trochanter. So right here is the greater trochanter, and here's the iliac crest. So as long as you're between these 2 points, you're going to go ahead and get the sacrum and coccyx together. Because remember, the coccyx is going to be at the end here, and this is going to be at the level of the greater trochanter, right? So, and if here, this is the crest, I know that my sacrum is going to start right below that. So this is your lateral sacrum and coccyx. I'm going to go ahead and set the technique at about 80 mass now. We're going to set it at 80 mass. If it was a smaller patient, about 60 would be okay. But we're going to set it at 80 mass at about 84, 88 kV on this young man here. So the sacrum is going to come down at an angle like this. All right, so I'm going to put my marker here. So if this is half of the half, and at an angle just like this, and this should be enough coverage. So when I close that up, it's going to be in the field, but it's not going to superimpose over the anatomy. All right, so now I can do my breathing technique. All right, so go ahead and breathe in, let it out, and breathe in and hold it. X-ray clear. You can go ahead and breathe and relax. Some places frown upon shielding. If you want, you can put a shield in the front. That shouldn't be an issue. If you want to put in the front for males, females you can't shield. But this is your lateral sacrum and coccyx. So again, I'm hoping this will help you guys. This is a relatively pretty easy procedure. Students often find that this exam is not too difficult, but again, just want to demonstrate it for you guys, okay? All right, thank you. Hello everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.